Good morning. This video belongs to group number 6 for one of the assignments for health policy. This group is composed by Elis Lopez, Pedro Fernandez, Marianela Trui, and me, Diana Penalver. So our group chose the law that was intended to pass on last year, 2016, and it's the one called SB-AA4, related to suicide awareness and prevention among youth. As per United Nations, youth is the group of age between 15 years of age and 24, just for statistic purposes. So this law was intended to add some kind of program of education during continuing education for healthcare professionals to create an awareness about this topic, which is one of the flagellas that, being maintained between the first 10 leading cause of death among this population. Policymakers need to work together with the healthcare providers and also the government to create some kind of law just to reduce the incidence and prevalence of this issue. Also to reduce the cost, because they are already encouraging in very high cost of attention. And we tried to pass that law last year. So
the literature review demonstrates that exists a direct relationship between suicide with economical issues, loss of job, and income disparities. The purpose of this law is to decrease the cost of the attention related with the suicide. The suicide impacts a family member negatively emotionally and increase the need of healthcare attention. It is needed to complete an accurate assessment in order to identify the early signs of this condition.
USA pointed out the high rate of mortality among the population at risk to commit suicide. With this bill, the ethical responsibility of governmental entity to design programs directed to reduce the incidence and prevalence of this social issue is also mentioned and emphasized. Behavior and pathologic personality disorder surrounding the suicide remain underreported, and data the collection method critical to suicide prevention need to be improved. The more educated and healthcare personnel on this subject, the more ability will be developed, recognizing the population at risk, with the consequent early intervention in an effort to avoid all negative impact that has been registered at present. The need is already identified, and suitable solution has to be created, being this law a perfect match to have a positive outcome.
Summarizing, this law was stopped last year in the appropriation committee. They stated that the healthcare personnel already have enough CEU to complete. If more hours are added, they can get overwhelmed. So they are proposing that the course should be work related. We are advocated for this law. We consider that at least 1 hour continued education can be very helpful and will provide RN with the instrument to actively prevent suicide among youth. Most of the time, suicide is not an election, it's a way out, it's a way to escape. And even though we are not in the position to judge those people that assume suicide as an option, we consider that it's very important for the community, it's very important for the nurse community, especially, in especial for the nurse community, receive that instrument to impact the incidence of DFLAGEL among our youth community.